Now, coming to the orthodontic considerations, there is a 5-stage of treatment: the infant orthopedics, early mixed incision treatment, and facial orthopedics, orthodontic treatment in relation to alveolar bone grafting, adolescent orthodontic treatment, and combined orthodontic and surgical treatment in early adulthood. Infant orthopedics aims at molding the alveolar segment into the correct anatomical position to facilitate lip repair by intraoral acrylic appliance. This is significant in reducing the severity and frequency of middle ear conditions. Now, coming to cardiovascular disorders. Here we will be covering infective endocarditis and hypertension. Infective endocarditis is a rare condition with high mortality and morbidity. The primary prevention of infective endocarditis is important. Antibiotic prophylaxis for such patients prior to an invasive procedure that could generate a bacteremia has been a founding principle of dental practice for half a century. Although evidence secondary to oral streptococci and Staphylococcus aureus is now the most common pathogen. Now, coming to the orthodontic assessment. First, we have to do a oral hygiene assessment of the patient. If the patient has a good oral hygiene, we have to assess the patient's cardiac condition, and depending on the grade of risk they have, treatment should be done with antibiotic coverage, or if they have minimal to no risk, the treatment can be done only if the antibiotic coverage is recommended by the physician. If the patient has poor oral hygiene, treatment should be avoided. Coming to the orthodontic considerations. Proper antibiotic prescription based on the risk level of the and the orthodontic procedure should be considered. Bonded brackets and elastomeric ties are preferable as compared to banding. All sharp edges should be smoothened and polished, and excessive adhesives should be removed and cleaned. Fixed acrylic appliances such as the NANs and acrylic rapid maxillary expanders should be avoided. And now coming to hypertension. Hypertension is the elevation of the blood pressure that significantly increases the risk of heart and brain disorders as well as other diseases. It is diagnosed when the measurement of the systolic blood pressure is higher than 140 millimeters of mercury on 2 consecutive days, or if the diastolic blood pressure is increased to more than 90 millimeters of mercury. Now, medications that are taken by hypertensive patients can affect the orthodontic tooth movement. Low doses of propranolol lowers the speed of orthodontic tooth movement. It has been previously proven that bone resorption by preventing a rancor-mediated osteoclastic differentiation and resorptive activity together with cytokine expression are curtailed by low doses of this specific substance. Losartan was also found to reduce the rate of orthodontic tooth movement.
Now, coming to gastrointestinal disorders, we are going to discuss about gastrointestinal reflux disease, which is a commonly found condition in many adults, and Crohn's disease. Now, what is gastrointestinal reflux disease? It is commonly known as GERD. It consists of troublesome symptoms and complications that result from the reflux of stomach contents into the esophagus. As you can see, the common symptoms are chest pains, painful burning sensation in the throat or the chest, trouble swallowing or eating normally, developing a sour taste in the mouth, excessive salivating, tooth erosion can happen due to the reflux of the acid contents of the stomach frequently into the mouth. Now, coming to gastrointestinal reflux disease, it's commonly known as GERD. It's a condition of troublesome symptoms and complications that result from the reflux of stomach contents into the esophagus. Some common symptoms of GERD are chest pains, painful burning sensations in the throat or chest, trouble salivating or eating normally, developing a sour taste in the mouth, excessive salivating, and tooth erosion, mainly because of the reflux of acid contents of stomach into the oral cavity. So the medications that we take for GERD are proton pump inhibitors and H2 antihistaminics such as famotidine, ranitidine, and proton pump inhibitors like omeprazole, rabeprazole, etc. Now, these medications can have certain effects on orthodontic tooth movement. So, a study was conducted in relation to this. So, in this study, uh, there this study was done in rats. So, these were divided into three groups: Group 1, 2, and 3. Now, in all these rats, uh, there was orthodontic treatment was done in the rats, and then some of the rats were administered famotidine, and then the effect of the tooth movement was studied. So, in group 1 and 2, they both had a super elastic closed coil spring between their teeth, uh, which was given to them for space closure, as we usually use in patients. Now, group 2 received saline daily. So the rats in group 2 didn't receive any medicine, and group 3 had no appliance inserted, but the animals were daily given saline. Now, in group 1, the rats which had super elastic nitre coil spring and which were treated in famotidine, the tooth movement was found to be significantly less on days 35 and 42 when compared to group 2. As you can see in this graph, where the group 1 is represented by this line. For easy reference, this group 1 line is represented by the triangle. Group 2 is represented by square, and group 3 is represented by circle. So in group 1, where the rats were given the nitre coil spring and were administered famotidine, the tooth movement was significantly less, and the changes in distances significantly differed between groups 1 and 2 compared with group 3 on day 7, 14, 21, and 42. In group 3, the distance between upper left first molar and the upper left incisors significantly increased from day 0 to day 42. So there are several phases of orthodontic tooth movement. Famotidine decreased the orthodontic tooth movement and the gene expression level of histamine H2 receptors increased during the late stage of the orthodontic tooth movement. So to summarize, famotidine can decrease the rate of orthodontic tooth movement if administered to patients undergoing orthodontic treatment. Now coming to Crohn's disease, it is a chronic relapsing inflammatory bowel disease. It is characterized by a transmural granulomatous inflammation, which can affect any part of the gastrointestinal tract, most commonly the ileum, colon, or both. Some common symptoms are there can be inflammation of the eyes, ulcers in the oral cavity can be seen. There is presence of stomatitis. Ulcers and sores on skin can be seen. So, orthodontic considerations. Only a few authors have examined the effects of glucocorticoids on orthodontic tooth movement. So, Crohn's disease is an autoimmune disease. The medications which we give for Crohn's disease are generally steroids. So now here the effects of steroids on orthodontic tooth movement is important. According to the few of the studies which were conducted, cortisone caused significant increase in the orthodontic tooth movement, while prednisolone had no significant effect, and methylprednisolone had caused a significant increase in the orthodontic tooth movement. Now coming to halitosis, it's defined as malodor with intensity beyond a socially acceptable level, which is perceived. It is a significant concern for many individuals and may negatively affect their quality of life and personal relationships. Halitosis is a problem which is encountered by the dentists on a daily basis. Some common causes of halitosis are poor oral care, infection, dry mouth, systemic illnesses and diseases, acid reflux, eating particular foods like garlic or onion, and some habits such as smoking and drinking. Coming to the treatment part, these patients can be prescribed sugar-free chewing gums, which stimulate saliva production in order to avoid dry mouth, good hydration, decreasing alcohol and coffee intake, proper dental care and oral hygiene, including daily flossing, gentle cleaning of the posterior portion of the tongue dorsum, rinsing and gargling with a mouthwash, most commonly chlorhexidine or Listerine mouthwash with essential oils before bedtime. If the patient has dry mouth or conditions such as gingivitis and periodontitis, these patients can then exhibit halitosis as a symptom. So it becomes important for the orthodontist to recognize this problem and then refer them to the concerned dentists for the treatment of that particular disorder, and hence avoiding any delays or avoiding any problems in the orthodontic treatment. Now coming to liver disease. Now, if the person is HBS AG negative but HBC AG positive, they are infective. HBV has an incubation period of 6 weeks to 6 months, and a small number of infected persons can progress to carrier state associated with chronic active hepatitis. Now coming to the orthodontic considerations. In patients having general liver disease, care should be taken when prescribing any medication for patients with liver disease. Hepatic impairment can lead to the failure of metabolism of some drugs and result in toxicity. Patients undergoing liver transplantation will be receiving immunosuppressive drugs that can cause gingival hyperplasia. Hemostasis will be affected, and this should be accounted for when planning the treatment. Persons having liver diseases, hepatitis, all patients should be treated as though they are infected, and universal cross-infection control precautions should be taken. Several studies have shown that orthodontists are more complacent than general dental practitioners with regard to a cross-infection. All members of the team should be immunized against hepatitis B virus. A booster dose is required in those with anti-HBs levels less than 100.
Moving on to renal disorders, the most common renal condition to present to the orthodontist is chronic renal failure. Chronic kidney disease is